so many people hear from the doctors, like, you just need to exercise and you just need to eat less. And that sort of has the implication that this is a person's fault and that they are at this weight because they haven't moved enough. Is something we really, really want to eradicate. Because what science has really helped us understand is that weight is regulated by biology.
Hello and welcome to Healthy Living. My name is Dr. Donald Pelto and I have Dr. Florencia Halperin. She is from Form Health. And Dr. Halperin, thank you for joining.
Thank you so much. It's such a pleasure to be with you.
And we met a little bit ago and we were kind of talking about our similar passions with helping people with weight loss and helping people with obesity. And you do that much more than I do. You're much of the expert. And I was thinking a lot of the listeners and viewers of this program would like to hear a little bit more about, you're working for a company now called Form Health. It's an online company. But let's just start at the beginning. Kind of what led you to have this focus in your medical career on helping people lose weight?
Yes, thank you so much. Great question. So I'm trained as an endocrinologist, and I'm originally from Argentina. And my first love in endocrinology was treating diabetes and specifically focusing on the Latino population, since I speak Spanish and I had a strong connection with that population, which is, very heavily affected by diabetes. And it was in that work that I realized how much people's weight and people's nutrition impacts their blood sugar control. And this was kind of revolutionary for me, like, oh, you can target someone's weight and nutrition as a form of treatment. And how much better people feel and how much so many different health markers improve. And then I was very fortunate to be at Brigham and Women's Hospital during my training and had the possibility to do research, because in those days we didn't actually know that much about how different forms of weight loss affect diabetes, but bariatric surgery had come on the scene as a big, sort of game changer in weight loss. And scientists started to notice also that their diabetes, the people who had surgery, their diabetes was improving. So I was able to do a lot of research on this. And through that, I got to follow people through a trajectory of weight loss. And again, it's just so rewarding to see someone be able to walk around the pond near their neighborhood or see their blood sugars improve with fewer medications, and feel better about themselves. It affects so many aspects of people's lives. And it's a very rewarding and powerful way to improve health. So that kind of got me started.
Yeah. And so you started to probably see small wins or patients doing better that you were treating, and that inspires you to help more. Can you help everyone, or can you only help those that want to be helped? How does that work? How do you find that in your job?
Well, that is such a good question. And I talk a lot about this because deciding to go sort of on a journey to lose weight is a really impactful way to improve your health, but it is hard. And I will never sugarcoat it to say that people don't have to kind of put in the work. And it has some difficult moments and some real rewards, and then other times when things are challenging, when you feel like you're doing everything right and the scale isn't budging. So a really important thing is that someone has to be motivated in the right frame of mind. And I think it has some parallels to quitting smoking.
Mm-hmm.
Most people who smoke think about quitting. Most doctors would recommend to them that they quit, but that doesn't mean that today is the day for everybody.
Mm-hmm.
So it works. I think as healthcare professionals, we have to always be teaching people and educating them that losing weight could be a really impactful for their health. But we also have to understand that where someone is in their life, it may not be the right moment. And when they do feel like they're motivated and they're ready and things are in place when they can do it, that's when we can really help. Before that, we can help move them along on the path to being ready. And then when someone is really ready, that's when we can have the most impact.
That's interesting. And it's probably similar to like quitting smoking or anything. You may have to try a couple of times before you make it.
Yes. And actually, in this field, the data, the information shows that people are sort of trying their whole lives. I mean, people try so many different diets, so many different strategies, because you can do it in so many different ways. You can buy a book, you can sign up for a program, you can see a physician. There are so many different ways. And most people that I see, I would say, have tried it before. Not everybody. Sometimes someone has sort of a wake-up call, like they go to a doctor for a checkup and they're told they have diabetes or something like that, and that losing weight could improve this, and they hadn't really known that before or tried before. But that's rare. More commonly, people kind of have been trying their whole lives. Sometimes they're successful, but they regain the weight or it doesn't work.
And now you used to be in kind of an institutional setting, like a big hospital setting, and now you're kind of like this, like we're chatting with now, this virtual setting. Tell me kind of how you got to where you're at today. What's your story?
Yeah, so it's, life is always unexpected. I was working in an institution, in an academic hospital. I still do work there 1 day a week, but as it happens, one of my patients introduced me to an entrepreneur who had the idea to do something very similar to what we were doing in an academic medical center, which is really developing expertise in treating obesity as a medical problem and connecting people with all the latest treatment options and also the most scientifically based ones, but to do it all through telemedicine. And I always like to highlight that this was a pre-COVID, pre-pandemic idea. And for me, I started as an advisor to the company, and then they brought me on as their chief medical officer. But this was in December of 2019. So before I had heard of the coronavirus, but it was sort of brewing in the air and in the news. So since then, of course, telemedicine has become very widely adopted. And it's nice to see how much people have sort of adopted it to, for the many benefits that it has. And our idea was always to do it through telemedicine. The thing about our specialty, obesity medicine, and we can talk a little bit more about that, is that there are very few physicians who have the board certification in this discipline in the US. It's between 4,000 and 5,000 total in the whole country. So one of our sort of missions and real reasons for doing it through telehealth is that we can really reach people where there are no local experts to help them. So that was a very important motivator. The other important motivator is that almost everybody has a phone in their pocket. But getting into the clinic and driving and paying for parking, those were things we always heard, from our patients, how difficult that is. And in weight management, the frequent connection, the accountability, the really intensive support, that's what a lot of studies have shown makes a big difference. So using the tools of technology and these phones that everybody carries in their pocket to connect with people right at the time when they're struggling, or in between, on their lunch break from work, and whenever it fits for them, was also just a very powerful idea for me, and it's turned out to be great.
Yeah, I in terms of this whole area of obesity medicine, maybe people that are listening, they'd have only heard of probably a bariatric surgeon they probably heard of, and a primary care doctor. And what they tend to tell patients, or maybe I'm incorrect, but I think a lot of them just say, I'd like you to lose weight. And when they ask, well, how do I do that, doctor? They might just say, work out more and eat less. Is that kind of the general trend? Or are there, so maybe the high tech ones would say, why don't you eat low carb? But how does that differ from what you tell people? And what does obesity medicine do?
Yeah, so great. I'm so happy to talk about that. Thanks for highlighting it. So the main sort of philosophical thing about obesity medicine is that we're really focusing on this as a medical and health condition. So your weight is a very important factor for how you feel, for mental health, we know this, and for physical health. And there are so many things on the list of what's associated with carrying excess weight. So the number of risks you're more likely to have if you carry excess weight is actually quite long. And some of them really surprise people. I mean, most people know diabetes, but cancer, many kinds of cancer are more likely if you have more weight. And so this is really about preventing and treating medical conditions, less than about a sort of, the way cosmetics or putting on a certain outfit or something like that. But everybody has their own individual reasons. We respect all of them, but our approach is really to think about it from a medical perspective. And part of the reason why that's so important, first of all, because of the things we can prevent if people lose weight before they get the medical conditions, but also because we don't just focus on a number on the scale. At the end of the day, treating weight for us really isn't about the number on the scale. It's about so many other things. So if you can walk more and have less heel pain, success. If your blood sugar numbers improve, success. So even if there isn't that much weight loss, because some of these things do improve a lot, even without a ton of weight loss.
Okay.
So that's one of the things about just our philosophy. And then in terms of what we actually do, and I think what you said is so correct. So many people hear from the doctors, like, you just need to exercise and you just need to eat less. And that sort of has the implication that this is a person's fault and that they are at this weight because they haven't moved enough,
not diligent enough,
or eaten enough. Exactly. And that is something we really, really want to eradicate, because what science has really helped us understand is that weight is regulated by biology. And it's very complicated. I can't give a whole, lecture on this, but our genes, what we inherit from our parents, has a big impact on determining our weight. What happens when we're in our mother's womb, during embryologic development, early in life, how you're fed, and then so many other things. But believe it or not, our brain is telling us we're hungry, we want to eat this, or we're full, we want to stop, eating this. And when they take a whole bunch of people in studies and they put them in a sort of locked study chamber and they feed them all the same thing, not everybody's weight responds in the same way. So this is, very complex, and really hormones and the way that the gut talks to the brain and talks to the fat cells. This is a very complex network that regulates our weight. So we want to really get away from blaming people for, a lack of willpower resulting in their weight. And instead, we want to try to really think about what are the reasons that this person has that are contributing to their weight. Now, that doesn't mean that nutrition and physical activity aren't core parts of their treatment, because they are, absolutely. But before we get to that treatment point, in the evaluation part of what we do as medical doctors, would really be to think about, could there be medications that the person is taking for other reasons that are causing weight gain or not permitting for the person to lose weight? Could there be other medical conditions? A lot of other sort of medical factors could be at play here. And if we don't think about them and treat them, then it's not going to be as easy for the person to lose weight. Once we've considered all of those things, though, we have sort of four pillars, we like to call them, of treatment. And so one of them is nutrition, one of them is physical activity, one of them is behavior change, because it's not just about like learning that this food maybe is healthier for you. It's also about how do you make that change day to day and sustain those changes, continue to done in that way. And the last pillar is weight loss medications. Weight loss medications, we can talk more about it, but they work in the brain and they work on all of those biologic connections that I talk about that regulates weight. So for some people who aren't successful with all of the other strategies, they really need that sort of tweaking of the biology to be successful.
Wow. And now you being the endocrinologist or the doctor doing your portion, does that mean, I think you work with a team. How does that approach look? Maybe is it you see them once a month and then a nutritionist every week and then a support group and then
Yes.
logs where they track how they're feeling? So tell me kind of a typical month of
I'll give you a typical month, although I will say a big part of what we do is make it really personal. Everybody's different and everybody needs a different approach. So we try to really look at the person and where they are and where they want to be and think about a very personalized approach. So the beginning is always an evaluation by the physician and thinking about, all of the things that I mentioned, and then putting together a treatment plan. And then for sure, other members of the team come into play and are crucial. So for changing nutrition and for changing behavior, we work very closely with dietitians. And at Form Health, patients actually get a team. So it's a physician and dietitian team that they're assigned to, and they see the dietitian every 2 weeks, but they can also text with their physician or their dietitian at any time. And people use this a lot because they may get stuck. They may have a question, they may need a little bit of positive reinforcement in so many different ways. So we're kind of always there for them. But every 2 weeks, they have a video visit with the dietitian, and then every month with the physician. And what happens at those visits is really variable depending on what the person is going through. A lot of times people bring to their visits places where they're stuck, like they really get hungry at 3 o'clock and their nutrition plan doesn't account for that right now, or their blood sugars are running too high, or they got recent blood from their physician and they want to, talk about it and how their weight could influence that. It's such a variety of things. We also work a lot with emotional eating because this is something that we see a lot. People are stressed, they don't have enough time, and they turn to eating as a sort of short-term comfort, and then they're dealing with the sort of mental consequences of like, oh, I shouldn't have eaten that. I didn't want to eat that. And now I feel badly and, kind of not being kind to themselves because of something that happened. So we really help them reframe. And as you highlighted, think about progress and think about how we can sort of reconnect them with a healthier relationship with food. So we're working on nutrition, we're working on helping people move more, sending reminders, helping them log and track, which is another thing that has been shown in a lot of studies. When people write things down that they eat or they log and track in some other way, it helps them really have an understanding of what's going on. It helps them set goals to make small changes. And that's how we get people to make big changes, by taking small steps at a time. So they work with us. And then, another really important thing is this isn't like a 4-week treatment or an 8-week treatment. This is really something that's a lifelong relationship that we hope to establish and to support people, because losing weight is hard, but keeping the weight off is another really important piece of this. And that's what we want people to do. We want people to lose it and keep it off. And most people need continued support to be able to keep it off.
Yeah. Is there a component of where one patient can talk to another patient, or let's say you have a more advanced one, can they speak to one that's just starting out? Hey, there's a diabetic, similar age, similar situation. Do you guys have anything like that?
It's really important, and we do. So we have Facebook. We have a Facebook community where it's only for our own patients, no one from the outside. But people talk to each other and help each other a lot, and it's fantastic. People post anything from like a great recipe for others to try to, really opening up about emotional struggles that they're having and getting that support from the rest of the community. So that's great. We do also do some support groups where that's more moderated by one of our team members with a specific topic, and kind of helping people to open up and share helpful strategies, and also doing some education. So helping each other is a really important part of the treatment as well. And actually something that we're building, because we've started with the sort of core team. And as we have a bigger practice and more patients in more states, we're also able to really build that network of support. Again, everybody's very different. So some people love support groups. Some people don't want anything to do with them. And we want to really create an environment where we can meet the needs of an individual in a lot of different ways, because a lot of weight loss strategies, there's the kind of like one way. And then if that's not working for you, you just kind of have to like quit or move on or something. And part of working with a professional team is that this is what was working before. Maybe that's not working anymore. Okay, we have other tools. Let's rethink this. Where are we today? Maybe different than where we started. And we are always trying to meet people where they are.
It seems like an obesity medicine specialist would have more almost like tools in their toolbox to try.
That's what we think. That's what we think, both because we can personalize it a lot and because we take these very thorough evaluations, not just of their medical history, but also like, what is the person eating? When are they struggling? You know, what is their physical activity? How could we help them? We're we're really specific about helping people identify their barriers. It's not just kind of like, oh, it's hard, I can't do it. If you really drill down on like, okay, well, why aren't you able to make time for exercise right now? What are the barriers? And then we can, if you are kind of aware of the barriers, then you can start to tackle them.
Yeah.
So we do, you know, get very personalized. And a big tool that we have that if you don't work with a physician, you don't have access to, are the weight loss medications.
Mm-hmm. Mm-hmm.
And again, this is important because it isn't for everybody. But for some people, they really are doing well with nutrition and with physical activity. And just because of the way that they're wired, they can't wait. And that's when adding a medication that reshapes some of those pathways that regulate weight can make such a big difference for somebody.
Perfect. And for some of our guests that are watching, what are some of the best strategies that you recommend, and maybe what are some of them that you advise against for people if they're kind of thinking, well, I could do this, I could do this. What are the ones that you recommend? Let's say they want to try things before they come and see a specialist. What do you recommend they try?
Yeah, that's a great question. Well, first of all, I always recommend that people know their weight and know their body mass index,
Mhm.
which takes into account their height as well as their weight, because that's really what risk is associated with. And that's, by the way, how we define how we define obesity. So obesity is a body mass index above 30. And it's helpful for people to know that, you know, are they in a higher risk category or not? Maybe they don't have to worry as much. Then if they do kind of realize that their weight is above where it should be and they want to lose weight, there are a few core things that I would say. There isn't really one best diet. We can talk a little bit more about this. What's important is to focus on diet quality. So eating healthier foods, less refined sugars, and more, I like to say, things that come from nature and not from a factory.
Okay.
Try to focus on those foods. Portions is important, though. You can eat very healthy quality, but if you eat a very large amount, your body will store the calories and you'll gain weight over time. So for sort of a very general diet guidance, I would say focus on healthier foods, more that come from nature, and portion control. And then the key thing is to help yourself make changes slowly, not to think that you're going on a diet, you're changing everything starting tomorrow morning, and then you're going to do it for 3 weeks and you're going to, you know, that's it. This is about making a healthy lifestyle. This is the new way that you're going to eat and, you know, and live. And shifting that mentality from I'm going on a diet to I lead a healthy lifestyle for the rest of my life and for my family. Those are really critical things. And then things that can help people put them into place are that tracking. So taking pictures of everything you eat or writing everything down. People don't like to do it, but they know, my patients over the years, when they do it, it works. Yep. It helps you bring a mindfulness to what you're doing so that you're really aware, and then you can really start to change it.
And having that accountability, like sending it to you or sending it to someone else or a friend.
Yes, the accountability is really important, and recruiting a buddy, a partner, someone who's going to be your support system. That's another great strategy. So you can have the accountability from a, clinical team, but you can also have it from your friends or your family or whoever, you feel like will really motivate you and help you stay accountable. That's another really important thing. I think measuring weight, keeping track is important, and with full realization that for some people it's just scary to get on the scale and they've sort of been burned. So maybe it's not for everybody, but science does show that tracking your weight, just like tracking other things that we've been talking about, is a good thing for outcomes, for getting results. So those are basic things that people can do on their own. And then a really big one is moving more. And we don't have to call it exercise because it can be anything. And one of, the wins that we celebrate with people are sometimes they run a whole 5K, and that's wonderful. But other times just walking down to the mailbox, down the driveway to the mailbox is an improvement for people, or walking out of your door, walking 5 minutes and 5 minutes back, which is 10 minutes. So wherever you are, adding a little bit more and trying to think about sort of cardio and trying to think about strength training and building muscle. Those are sort of important components, both of them. But you have to start where you are and just build a little. And then if you build over time, you can make big changes by building a little bit over time.
Good. Those are good. And for those that are listening, what are some of the things that you advise against? What are some things that you see people coming in or people do and you just say, probably not good for you?
Yeah, that's such a good question. And unfortunately, there's a lot on the do not list, just because there are so many supplements. There are so many people selling things, claiming that this will help you lose weight, that it will burn the fat off. Supplements are not regulated by the Food and Drug Administration in the same way that medications are. So the things that we work with are prescription medications. You can't get them unless you have a prescription for them. And they only get approved after years of rigorous clinical trials. Supplements, it's really incredible what the science shows. Not every pill inside that bottle has the same stuff in it. Sometimes when other scientists come in and test what's in the pills, it's not what's on the label. And some of those things can really do harm. And I have personal experience with this because I have seen people admitted to the hospital taking things for weight loss and then having, heart problems or liver failure or really serious things like that. So I really advise against weight loss supplements. And then the other big thing is the fad diet. Like I said before, I'm going on a diet, I'm giving it my all for 3 weeks, and then that's it.
That's a lot. Yeah.
For people who really have excess weight to lose, I mean, that might be okay for someone who's trying to lose a few pounds, but maybe not. But for people who have weight to lose and, it's really about getting healthier, we have to focus on the long term.
Yep.
And a lot of studies have shown that even just improving your diet quality helps with things like blood pressure. Even in some studies, they don't lose weight, but they just improve their diet quality and their blood pressure goes down. So you have to sort of be thinking about the right reasons for doing some of the things. I would really caution people against thinking that it's sort of one and done, like you do this fad diet and then you're done.
I feel like so many people, I think this is just the society now. We're all looking for that one magic pill or that best diet or that simple one thing. And from everything that you're saying, it doesn't sound like there's a best diet. It sounds like it's almost like pieces of a puzzle that need to go together, right? For the people that really, let's say people 30, 40, 50 pounds, it's not just a one-off.
Exactly. And everybody's puzzle is a little bit different. So it would be so easy to have one, I like to call it a magic dust that you sort of sprinkle on people and then they're done. But unfortunately that doesn't exist. And we have to really understand in each person kind of what are the factors that play and then help them, because it really, I mean, I hear people's stories all day long, and no two stories are ever the same. You know, some people are really eating healthy quality diet, but then the demons sort of come out at night and they just snack so much at night when they're relaxing and watching TV, and tons of calories and refined sugars creep in at that time. Other people, it starts from breakfast and they really don't have, you know, the opportunity to, or they haven't to eat healthy foods. And so right off the bat, they're driving to a fast food shop on the way to work, and they're starting off the day with fast food, and it sort of stays that way. And everything in between. People's lives are so different, and people's challenges are so different. So we need to think about really sort of like the right puzzle is for every person. But I agree exactly with what you said. It's about fitting everything together to make a plan that works.
Very good. And stories are always helpful. Do you have any memorable success stories of some of your patients that you've been dealing with? Kind of, you know, tell us some of those.
Yes. I mean, I have so many stories, as I sort of started in the beginning, about people who were able to really go from having diabetes and being on insulin to, you know, not needing insulin anymore. So I love those stories because that really highlights how powerful a tool weight is for health.
Getting off insulin or diabetes.
Getting off insulin is amazing. And it does happen, getting off insulin and other diabetes medications. So there are a lot of sort of medical successes, but I also love the personal successes. So I have a patient who she's no longer my patient, but she was my patient for a long time. And she was a wonderful lady, and she loved taking her family to Disney World for a once a year kind of, you know, all out vacation. And for many years of her life, she actually couldn't go on a lot of the rides because there's a weight maximum. And so the year that we worked really hard together, and she was able to be under the cutoffs, and so she took her family to Disney and she was able to participate with the ride. That is like something I'll always remember. But you know, but little wins too. Like I mentioned, the person who can walk to the end of the driveway when they couldn't do that. These are things that are, it's just heartwarming. You know, a lot of people talk about their relationship with other family members. Like now they can run around with their grandkids, and, you know, do activities that they couldn't do before. I love those. I love those stories.
Well, very good. I think we've covered a lot here. This has been an interview with Dr. Florencia Halperin, and she is with Form Health. If people want to learn more about Form Health, where could they go and where could they get more information?
Yes, wonderful. Well, our website would be a great place to do that. It's www.formhealth.co. There's no M at the end, just .co. And that does have a lot of information. And actually it has information for potential patients and also for any physicians who would want to refer patients to us, because as you know, sometimes physicians need to recommend weight loss to their patients and don't have good resources in their community to help the patients with that. So we invite everyone to visit our website. We also have, we're on social media, Instagram and Facebook. They can all find it through Form Health.
Well, great. Well, thank you so much. It's been an honor. I think we learned a lot and we covered a lot of topics.
Thank you so much. And as I told you before, I'm just so happy that you have taken this kind of healthy living thing so seriously and are helping to get the word out there and to educate people. It's really wonderful. So thanks for including me in your efforts.
Hey guys, thank you for watching Healthy Living. You're going to find a few links here I'd like you to click. One is to subscribe to this channel on YouTube. Also, you can learn more. There are some videos here you can see.